Cradle Cincinnati applies a focus on Black babies born to Black mothers because here in the city of Cincinnati and across the country, infants born to Black mothers are more than twice as likely to die before their first birthday due to the experience of racism. We know from the science of adverse childhood experiences that exposure to emotional, physical, and psychological stresses earlier in life can have long-term consequences for mental and physical health. If stress can be transmitted from mother to child, imagine how enduring the stress of racism over centuries has changed DNA of generations of families of color.
The racism can actually affect diabetes and heart disease. Like who would have known? Especially because we had been told all this time really that, well, African Americans, you guys just eat a lot of fats and cholesterol and you don't work out and that's why you're sick, which I think some of that may apply, but the fact of the matter is that there's something else going on there too.
That something else is the experience of racism, discrimination, and subjugation endured over generations. The evidence is clear. Adversity endured over generations produces higher susceptibility to health and mental disorders due to the intergenerational transmission of stress.
I really think it's powerful once people can make the connection that if we live in an unjust society, if kids and families grow up in communities where there is no justice and where there is therefore more stress, we know racism, poverty can be huge causes of stress and toxic stress that affects development and childhood well-being.
There is perhaps no clearer way to understand the cumulative impact of stress and disparity than by comparing life expectancy differences across neighborhoods in Cincinnati. The average life expectancy in Cincinnati is 76 years, but when you zoom into neighborhoods, that average can vary widely, a gradient that follows closely with poverty, race, and education. In short, neighborhoods with lower income, lower educational attainment levels, and higher concentrations of people of color have shorter lifespans. For instance, we measure a nearly 10-year difference between Cincinnati's largest predominantly Black neighborhood, Avondale, and neighboring North Avondale, where the population is more than 50% white and more highly educated.
There is a 20 life year difference between different communities here. And so as we're talking about chronic diseases such as cancer, hypertension, diabetes, things of that nature, it's causing a larger impact on our Black neighborhoods and making it so that we're not living as long as other neighborhoods in Cincinnati.